that most facial procedures, most plastic surgery has always been done under general anesthetic. And general anesthetic, what does that mean? Well, it's a relatively invasive type of anesthetic because a tube is put down the airway, that's called intubation. Various medicines are given to the patient, but machines are used to help you breathe. And so it is a bit of a shock to the body. So when you wake up from general anesthetic, most people will be a bit disorientated. You can have a bit of a sore throat from the tube. About 30% of people will feel a bit nauseous or a bit sick. And some people will feel a bit washed out, sometimes for 1 week, sometimes even longer. And those things, generally, they're not terrible, but generally they're not like a great experience. And there's always a tiny risk. And even though that risk is small, there's a risk of a clot in the leg. That's called a deep vein thrombosis, and that can be very serious. There's a small risk of reaction to inhaled gases. And again, that can also be very serious. So in a way, many like aesthetic type procedures, well, patients are choosing to have that procedure. It's an elective procedure. So really, we want to minimize that risk as far as possible. And sedation or twilight anesthetic, well, what that means is the patient is actually sleeping under the surgery. So they're still breathing themselves. All their natural protective reflexes are working normally. You're just kind of sleeping under the medicine. So in a way, it's a very safe kind of anesthetic because, like when you sleep, we could stop the anesthetic at any point and you would just wake up from the sedation. And I mean, we pioneered it in the UK. We have like a patent for the formulation. And in a way, over time, we've used it for longer and longer procedures. And so we can do procedures that are 5 hours, 6 hours, 7 hours. And well, we've even used it occasionally for 8-hour procedures. And the difference with sedation is, well, just because you're just sleeping on the medicine, when we stop the sedation, even if it's 6-7 hours long, patients will wake up over half an hour. You can walk out of the operating theater. It doesn't take nearly as much out of you. And so it's just night and day in terms of things. And even though the risks with general anesthetic are small, well, with sedation, because your own natural reflexes are working normally, well, you wouldn't expect to have a clot during your sleep unless you've got like something else going on. Similarly, under sedation, it protects you from that. And in addition to that, it's pretty relaxing. So the same medicines that are used for reducing anxiety and relaxing, well, they're also the same medicines that are used for sedation. So actually, many people, they will just come back to have the sedation regardless, because it tends to be just a more pleasant experience. Yes, the golden ratio is a proportion. So that proportion is 1.618, and it's been used in many forms of art, design, and it's also it's a proportion that you can find in nature, in flowers, and so it's a proportion that really is elegant and harmonious. So buildings that have the golden ratio tend to look elegant and well designed. In the Renaissance period, Leonardo da Vinci used the golden ratio in many of the paintings, and that's what gave like paintings like the Last Supper so much depth and proportion. And so how can we use it like in the face? Well, we can use the golden ratio to look at proportions within the face to look for harmony. So someone who's say got like a small chin, well, we can look at the proportions of their face, their lips to the chin, and it can give us an absolute objective number. And that objective number can signify disharmony in the face. And so it's not the only thing that can be used, but it's a tool that we can use to objectively measure beauty. And that's been one of the most challenging things. How do we measure beauty or attractiveness? It's a difficult quandary that even philosophers have debated about. We can all see a beautiful face when we see it, but how do you actually measure that? So the golden ratio is a tool that we can use to help look at the face and facial balance. And so I use it to help some of my patients who are just looking to improve their appearance. They're not necessarily looking for a massive change, they're looking for refinement, and then we can use this as a tool to look at that and see how we can look for disharmony in the face. So how do I decide what a patient needs? Well, in a way, it's a good question, because in a way, the first thing I would always do is listen to what patients really notice, because that really is the number one thing. And many patients notice different things. And so key is what that individual person notices in relation to the characteristics of their face. Then the other element is, what about their general health? If they've got issues with high blood pressure or other medical factors, anemia, well, we always need to consider safety, because safety is the number one thing before considering anything. And then other things, well, I always ask patients to bring like old photographs, because if there's facial aging, well, we can see how their individual face has changed with time. And one aspect is listening to the patient and finding what their expectations are from the surgery. But then the other factor is just looking at the detail around that. And sometimes, well, it might be that the patient notices one, two, or three things around their eyes. However, if they've got like laxity in the eyelid, key is that laxity is improved at the same time to avoid issues afterwards, such as dry eyes, such as eyelid retraction. And almost every part of the face has a few nuances that are important to look at. So it might be a patient comes with aging and they really hate their jawline and their neck. And sometimes patients have not liked it even from a young age, even their 20s and 30s. And that is likely to signify a genetic element to the aging. And that genetic element may be, well, actually they've got like a genetic element of fat in the neck. It might mean that the very bottom of their submandibular salivary gland, rather than being tucked up under the jawline, it's just sitting lower. And so then we can look at those details at the same time and sometimes amend that at the time of the surgery to give a more like shaped neck. And then probably the final element is like just life events, because all of us have events in our life that can be great and you can feel on top of the world, and all of us can have events whether it's passing of a family member or a relationship issue. Well, it's never a good idea to do any kind of procedure when someone's had a recent life event, because that emotion can be really raw, and it can ultimately mean that the recovery is a really emotional roller coaster. And so I will take all of these things into account. And sometimes I've advised patients, well, maybe now is not the right time to have a procedure. Maybe it's a good idea to wait a little bit longer if they've had a recent life event. But out of these things we've been discussing, well, key is that we not only reach a patient's expectations, but generally we look to surpass them. Key is that we're safe and we don't do anything that could cause any harm. And then it's a question of like that individual person, if they've had any life events, taking that into account with kind of healing and recovery. So I think when we look at a face and what makes a face beautiful, well, one thing that people always draw to is symmetry. Symmetry equals beauty. But the reality is absolutely everyone has a degree of asymmetry. And it's not a question of if, it's just how much asymmetry. And so Leonardo da Vinci used to draw the face into thirds and fifths and look at proportions in relation to symmetry. But the reality is almost every person, if you take your face and you divide it in the midline and you create a mirror of your right side and a mirror of your left side, you end up with three different looking people. You end up with a slim version, a plump version, and one that's actually you. And so asymmetry can be important, but it's also normal. I would say more important than that is harmony and facial balance. And we mentioned previously, like if you've got a slightly smaller chin, well, it can just throw out proportions of the face. It can make your nose look a bit more prominent and longer or bigger. It can soften the changes in your neck. So the neck, rather than starting as a more shaped curve, it can start almost where your chin is. And so there's all these elements that are related to facial harmony. And so often when looking at a face, it's that balance between certain elements that are important. The other element is kind of youthfulness. We live in a culture where youthfulness is so important, whether it's like personal, professional. And so, every day we're kind of like see all these images of social media of people who, look youthful. now with Monday techniques, there are actors, actresses who may be in their 60s, but they look in their 40s, like Demi Moore. And so that there's definitely like a more favorable appearance just to looking your very best, and often that's, and youthfulness is a part of that. So general anesthetic, historically, general anesthetic has been used for most plastic surgery. And so general anesthetic is a bit traumatic in terms of experience, in that you have a tube down the airway for breathing, you have like machines that breathe for you, and so when you wake up from general anesthetic, it can be a bit traumatic. You can have a sore throat, you can feel nauseous and sick, and sometimes patients can have other things. Although rare, you can have things like shock hair loss. I had a patient this week who had a procedure some years ago, and that was the one defining thing that she remembers from the procedure. And although that is relatively uncommon, it's certainly not like incredibly rare. It's like well known. So there are these factors with general anesthetic. It is a bit of a trauma to the body. So if we can do anything to kind of reduce that, it's favorable. And the mirror opposite of general anesthetic is local anesthetic. And local anesthetic means you're 100% awake. And that can be used for smaller procedures, but for most procedures on the face, it's a delicate area, it's sensitive. Local anesthetic is not ideal. I have used local anesthetic some years ago for eyelid surgery, upper eyelid surgery, and with the right team, and if you have like nice soul music playing and an empathetic team, well, that can go like a long way, but you can still hear everything. You can still hear every like in a way every like machine like beeping, and so it's for some patients it doesn't matter how good their music is, it's a bit more traumatic. And what we found is sedation anesthesia or twilight anesthesia, well, it's somewhere in the middle of local anesthetic and general anesthetic. And by that, it means you're sleeping under the medicine, but it's not as invasive as general anesthetic. And so most patients can't actually tell the difference because they're kind of sleeping. But it's different in that when it's stopped, the recovery is much faster. Like you wake up over half an hour, things like your vital signs, your heart rate, your blood pressure doesn't change very much with the sedation. So when you wake up, it's just a smoother kind of journey. And patients tend to have less swelling and bruising. And in certain surgeries, like face and neck lift surgery, well, under general anesthetic, the risk of a hematoma is estimated from 8 to 12%. And a hematoma is like a large bruise. And that hematoma, it can be the size of a golf ball, it can be the size of a tennis ball, or it can be much more dramatic than that. Well, under sedation, things like your vital signs, it doesn't change very much. And so the risk of a hematoma, in my experience, is less than 1%. And you can never say never, but it's much, much smaller risk in terms of things. And that has changed the way some surgery is done, because currently doctors who use a lot more general anesthetic, they'll do something called a hemostatic net for patients, which means lots and lots of stitches are interwoven into the skin for several days. But with sedation, actually, that's not truly necessary because we're just not carrying that level of risk. So I think general anesthetic has been used historically, but now we're moving into an era where we can use alternative technologies, and sedation, twilight anesthetic is one way to do that. When we started doing the surgery, like more than 10 years ago, it was difficult to do sedation because there were very few anesthetists who were skilled in it. So with a team of anesthetists, we gradually build up that skill. And now we've been using it for more than 10 years, and every single year we audit the results. We look at refining the technique, and sometimes we've added certain medicines and taken certain ones away. And so now, having used it for over 10 years, well, we have a patent for the formulation, but we also have treated many patients who've had really difficult experiences under general anesthetic, really difficult experiences under local anesthetic, and then we've been able to kind of blend that to give them, a much better experience. So in terms of recovery, well, most patients, recovery is one of the most important aspects of healing, because most people, they want to get back to their normal day lives, whether it's with family, whether it's going back to work. So recovery is really important. So one of the things is like actually during the surgery, like we'll use the latest kind of technology to speed up recovery as much as we can. So one of those might be fibrin tissue adhesive. And previously I did like a randomized control study looking at the use of fibrin adhesive in eyelid surgery and blepharoplasty. But over years, that technology has improved, and now we can use that in facial procedures to speed up how quickly the body heals. Because fibrin tissue adhesive essentially is the first stage of healing when the body heals. And so it's changed my practice in that I no longer use drains. I no longer use netting stitches, because we can use this kind of technology, which is kind of leaping us forward in terms of healing. And then after the surgery, well, there are lots of things that we can do if that's necessary to speed up healing. So what would that be? Well, we have hyperbaric oxygen, and oxygen is the elixir for healing and recovery. So it's like a chamber which you sit in for an hour, and you breathe in like higher concentration oxygen, and it will heal the soft tissues faster. And sometimes we've had patients who've got other issues, like a back issue, and often it will improve those other inflammatory conditions at the same time. In addition to that, if someone's got a little bit more swelling around their face or the neck, we can do something called lymphatic drainage. And one of my team is skilled in that, and that's a form of pushing swelling down the lymphatic drainage system. And most patients will see a difference like after doing that. And several sessions of that can speed up healing. And there are other things like light therapy. So you can have like light therapy at home. There's kind of like LED masks. Now we have a very powerful machine that is like the size of a refrigerator, and that we can use to heal particularly the skin. So if you've had like skin resurfacing, whether it's laser or radio frequency, it will speed up how quickly the skin heals. And then there are other things like regenerative medicine. And regenerative medicine is really the frontier of what we understand about medicine right now. And what it means is using your own body to heal you faster. So one form would be platelet-rich plasma, another would be amniotic membrane, another would be the use of fat in stem cell technology. So PRP means taking some of your own blood, concentrating it, spinning it twice in a machine to get to deliver your own PRP. And essentially that's your own growth factors. And if we put that into the areas of, say, the scar or the skin that's healing, it will speed up how quickly that heals. Regenerative medicine, when it comes to the use of fat, well, I'd say that's right at the frontier. And certainly in the US, some doctors say we're doing like a stem cell facelift, but essentially we're doing fat transfer. But within that fat, there are these regenerative cells that have similar properties to stem cells, and so they have a healing effect on the skin and the soft tissues. But in a way, we're still working out how to use that technology. We know that if we use it in the face, it improves the results. But exactly how that's happening, we don't yet understand. But all of these things can speed up healing and speed up recovery.